Frozen shoulder is one of the most misdiagnosed shoulder conditions I see in the clinic. Many people are told they have frozen shoulder when in fact it's something else, like a shoulder derangement or even a neck issue mimicking the same symptoms. In this video, we'll break down what a frozen shoulder really is, how it typically presents, and what can masquerade a frozen shoulder, and how to determine if you have a frozen shoulder or is it something else. So what exactly is a frozen shoulder? Frozen shoulder is known as adhesive capsulitis. It occurs when the capsule around your shoulder joint becomes inflamed and it tightens. It affects more women than men, most often between the ages of 40 and 60. Metabolic health plays a major role as well. So conditions like diabetes, high blood pressure, blood sugar, elevated lipids significantly increase the risk, likely contributing to the inflammation and the tissue changes in the shoulder capsule. As the capsule thickens and stiffens, motion becomes restricted and pain increases. Frozen shoulder usually progresses through 3 stages: a painful stage, a frozen stage, and finally a thawing stage. The good news is that most cases resolve on their own. The bad news is it can take up to 2 to 3 years without the right care. But there are things that you can do that can speed this up significantly. So how does a frozen shoulder present? Typically, when you have a frozen shoulder, you're going to have a loss of range of motion. But again, like I said, there's other things that can mimic those. We'll talk about those later. But common things are reaching behind your back, like reaching behind like this, reaching over to grab something, reaching up, anything. There's a lot of shoulder restriction, and it's usually pretty painful. Common things that doctors will tell you to start to do are interventions like manipulations. Manipulations really, there's not a lot of evidence that shows that this is something that you should do. Often you'll find that you'll have to do a second one on top of that. And when you have the capsule that is so tight, you get like adhesions that like really restrict that range of motion. You can get some tearing in your capsule, tearing in your labrum. You can get rotator cuff tears from those manipulations, bruising, fractures. I mean, there's a lot of things that can happen with that manipulation, and honestly, you just don't progress that quickly. Another common treatment that they'll do is actually give you cortisone injections. And now cortisone may give you that short-term like relief, but long-term, it's not really a healing agent. It is something that will weaken the tissues. And so we don't really recommend going into doing cortisone injections or doing manipulations. And we'll talk about some things that you can do that will speed up this healing that work really well. But let's go into how we can diagnose this. When you have something that has a frozen shoulder or adhesive capsulitis, whichever one they want to tell you, you should present with a capsular pattern. You can have loss of motion in that shoulder and it be other things. We'll talk about that here in a second. But what is a capsular pattern? A capsular pattern is when you're limited in external, like the worst motion you have is moving your shoulder in external rotation, moving it out in this direction, followed by abduction, followed by internal rotation, followed by flexion. So that's worst to best. You should have a capsular pattern, and that's kind of how we know that this potentially could be a frozen shoulder. More than likely, if you have a capsular pattern, it's a frozen shoulder. And so if you don't have a capsular pattern, because let's say, oh man, I can really rotate in through here, but I have a hard time reaching up, or it's tight here, and tight through here, but my rotation actually isn't that big of a deal. And so you'll find things where you're really limited that can be other things, what we call kind of a shoulder derangement. And what does that mean? A shoulder derangement is something where you have we have material within the joint. There are bursas. How I kind of describe this, like for instance, you can have people, let's say they're painting or they're volleyball players and they're constantly slamming like the ball down in this direction, and you're always taking the joint in that same motion, you create these pathways that that lock the joint up. So a lot of times, when we go and ask, like, what does a day look like for you? And, it's someone that comes in, let's say they're a volleyball player and they're doing these, I'm almost instantly going to take them into some extension or some extension with rotation, because it's flexion with that rotation. We'll go into extension with rotation and it'll unlock the joint like this. They're rapidly changing, so we can get results really quickly, because it's just getting the joint material to kind of get back into place from doing some repeated motions. Or sometimes when people fall, same kind of thing can happen in that shoulder, that where we have to actually repeatedly move the shoulder in a motion, and it unlocks everything else. And so these are things that we're looking at. So if you don't have a capsular pattern, then we're looking at potentially this could be a shoulder derangement. Now, before we even get into diagnosing if it's a shoulder derangement, we always want to rule out the neck, because the neck refers a lot into the shoulder. So again, you have limited motion, you don't have a capsular pattern, those are the biggest things that we're looking for. Then we're looking at other ways. Even if you do have a capsular pattern, I'm going to rule out that neck, because there's been times when people had a rotator cuff surgery and they have all this pain. Their neck motion doesn't look that bad, but I'm just going to rule it out. I take them to in range, and all of a sudden their shoulder motion improves like this. And so you have to rule in the spine or rule it out to make sure that there's nothing going on there, because a lot of what happens through here refers into the shoulder. You can have rib stuff that also makes it hard for us to move the shoulder, even into external rotation, internal rotation. And so we have got to rule out the spine. So the biggest things that we're looking at is, do they have a capsular pattern? If they have a capsular pattern, I'm still going to probably rule out that spine just to be on the safe side. But if they have a capsular pattern, which is, let's go over it again, external rotation is the worst, followed by the next worst is abduction, followed by the next worst is internal rotation, and then it's followed by shoulder flexion. Now, we also find when people really truly do have a frozen shoulder, internal rotation, functional internal rotation is the worst. This is the one that is the last to come. For whatever reason, the functional internal rotation is the last to come. And so if that sounds like you, then you probably have a frozen shoulder. So make sure you stay tuned, because my next video that we're going to be doing that's coming up, we'll talk about what you can do to speed up the recovery for a frozen shoulder. And then there's things that we're doing that's new technology that we're using that's significantly speeding things up to getting people feeling much better, much quickly. But we'll talk about that in our next video. So before you accept the diagnosis of frozen shoulder, make sure it's truly one. If your range of motion is changing quickly, or if your symptoms line up with your neck, you might not have a shoulder problem at all. Remember, frozen shoulder has a capsular pattern, so if you do not have a capsular pattern, you've got to look at other sources to your problem. If this video is helpful, hit the like button, subscribe for weekly tips on solving pain problems, and share this with someone who has been told they have frozen shoulder. And if you've been struggling with shoulder pain and wanting to find answers, and you live in the DFW area, go to the description and click on the free discovery visit. This is where you can get your questions answered, learn why you're not healing, and how we can help. We have limited spots each week, so don't delay in signing up.